Before Faye's injury, she was a workaholic. She had her horses, her dog. She was very active. She started off with all the conventional treatments, seeing a physio, having standard medication. And when she wasn't improving, they referred her to, she had an MRI and a few different things first, and then they referred her to an orthopaedic surgeon. But then she'd been in hospital quite some time. She'd had so many painkillers. She was on the oxycodone, and she was discharged on oxycodone 20 milligrams, but that increased to 200.
Patients are being prescribed increasing numbers of medications, and sometimes it's not clear whether any of those drugs are actually doing the job they're supposed to do. And the more drugs are added in, all have side effects, the more likely there are to be increased side effects, increased interactions between those medications. And so there should be a regular review to assess whether the medication is actually doing what it's supposed to be doing, and if not, it should be reduced and withdrawn. If clinicians prescribe medications that are inappropriate for the condition, there are many implications arising from that, such as patients being on drugs which are harming them, being on drugs which may interact with other drugs that are then introduced at a later stage, and then suffering consequences.
She escalated, or was escalated, on all these different drugs to try and help her. She had so many symptoms from the oxycodone, and because of her back not being mobile, having been very active before, she put the weight on and developed sleep apnea. Her husband said she used to go to bed for a few hours, then get up later when she was feeling a bit better, and then she'd go back to bed and have the sleep mask on. But when he went into the bedroom, she hadn't got up. He said she was blue, not breathing. He dialed 999, and they obviously told him to start CPR, get her on the floor, etc., etc. So they couldn't get her back.
Key messages for prescribers are available in this region on our websites for prescribing around analgesia. And because there is limited evidence that any medication helps to control pain, but there is some evidence that some people do extremely well, it is always worth trying the medication if the patient presents with a particular symptom. But you should assess whether it helps, and you should withdraw it after 6 weeks if there has not been any significant change.